Today we're talking about dental trauma. I'm going to break up dental trauma into categories. The first one is traumatic habits. People don't think about it, but everything from biting our nails to using our teeth to open up a bag of chips, beer bottles, we've all seen this out in bars. And then, of course, grinding and clenching. So excessive grinding and clenching is called bruxism. And bruxism, nail biting, are actually characteristics that we find when patients have mental health conditions, anything from obsessive compulsive disorder to depression, high functional depression, anxiety, nervousness, fear, and then, of course, pain. Symptoms of mental health conditions often manifest in occlusal or dental trauma. So we'll look at your nails, but we'll also see evidence of wear on our front teeth. And early wear make our teeth look old. So if you're trying to worry about aesthetics, then certainly you want to think about why you are biting your nails and why you may be clenching or grinding your teeth. We want you to think about your overall lifestyle and what is causing that stress so that you can reallocate that stress, whether it's through therapy or other cognitive activities, behaviors, so that you can take the load off of your teeth. So we have habits that create traumatic forces and manifest trauma on our teeth. We also have accidents, whether it's a sport accident, a fall, you've become dizzy, or maybe your neurology was off and you fell. That may also manifest in trauma. So we may see a chipped tooth and someone's like, oh, I fell down the steps, or I slipped, or, I was at school and somebody pushed me, or what have you. And then finally, one area that's very sensitive is abuse. And for women in particular, domestic abuse goes underreported. As a dental provider for 20 years, I have seen more than 2 hands of patients who have come in with chief concerns or even subtle concerns to repair teeth that have been affected by domestic abuse. And so there's an emotional and professional responsibility that I have to connect with my patient and to offer support. But in terms of, raising awareness, we all need to be aware of getting help with our lifestyles. So I'm going to put information in our notes about, hotlines and websites that can help anyone who may be suffering from domestic abuse. Okay, so we've divided dental trauma into 3 categories: bad habits, accidents, whether they're sport accidents, soccer, you got knocked in the face, or basketball, you got elbowed in the tooth, and then, of course, abuse. What can we do to prevent the wear from grinding our teeth? We can wear night guards, and they're made of a certain plastic that's thick enough to bring our teeth apart, because we need to have a certain height of distance between our teeth so that we don't wear them. And that plastic is typically very thick, so it needs to be fabricated by a dental professional. There are a lot of over-the-counter dental guards, but the American Dental Association now really guides patients to the dental office. Since COVID, I think bruxism went up 600%. So everybody and your mom is grinding her teeth, and dental guards are often indicated. Another thing we can do in terms of our bad habits is to reallocate our stress. So be conscious. If you're biting your nails while you're watching TV, then, put a note under the TV, don't bite your nails. Think about it. Smile. Did you know that when you smile, when you speak, and when you laugh, your teeth are not together? My teeth don't come together when I'm speaking. I always say laughter and smiling is the best dental therapy. Finally, sports. Sports guards are recommended even for weightlifting, soccer, gymnastics. Sports guards are recommended. Your teeth actually protect you from concussion. Your teeth are the first line of defense. And then, as we can imagine, our TMJ can also be impacted by dental trauma. Night guards, sports guards, and reallocating stress is a way to prevent some of these traumatic injuries. What do we do to fix traumatic injuries? Well, we're talking about women's oral health, and women are more heavily scrutinized for defects. Young men can go on and on. They'll get married. They'll get promotions. No one is really even notices a chip. But on a woman, it can be devastating. This is my experience providing to patients for 20 years. It can be a big deal. Now, a small chip, sometimes it doesn't even need anesthesia. We can repair by placing a tooth-colored material. It's made of plastic. It's a composite material, a resin, and we bond it to your tooth, and it looks brand new. It can be great if the chip is really small. Now, if the chip is bigger, it may need a larger restoration. That could be a veneer or a crown. If the tooth has become damaged from a traumatic event that actually created an infection or knocked the tooth from the socket, moved it a little bit, then you may need root canal. And then after that root canal, a restoration, whether it's a filling or a crown, can be done. On a severe level, if a tooth becomes infected or knocked out of our jaw, then the best replacement is an implant. Dental implants are very successful. The prognosis for most implants is excellent, and they're the type of restorations that will outlive you. Patients are always asking me, is this going to last forever? About a filling. A filling will not last forever. Your tooth didn't last forever, right? You got your molar when you were 6 years old. You put a starburst on it, it got a cavity, ... It needed more treatment. As dental providers, we want patients to understand realistically that it's a combination of prevention and treatment and being conscious of our behaviors. I talked about dental trauma, and I want to say to women, again, a very serious topic is domestic abuse. And our loved ones, our family members, our friends, sometimes there are no symptoms, and sometimes we see symptoms, and we're always curious to inquire further. Thank you so much for getting on here to talk about women's oral health and dental trauma.